So first of all, good morning to all of you. And I want to thank the committee for inviting me to speak on a topic that I think is pretty controversial, you would agree. I am both a clinician, have done a lot of pain management, chronic disease management back in New York. I currently, I'm a faculty member at Cornell in New York, seconded to its campus in the Middle East. So I am a part of the movement of Cornell that is doing a lot of global health. And you can imagine, when I use the word CAM, I'll be referring to complementary and alternate medicine, and I'll come to the definitions of these terms. It's only a snapshot. In fact, it will be only a mini snapshot given the time that I have, but I think I'll utilize the 2 extra minutes that I have. So I have nothing to disclose. So this is what I plan to do in the next 15 to 20 minutes. So we look at some basics. I'll present to you evidence as much as I can, focusing only on 3 or 4 important things. The role of antioxidants in cancer, acupuncture in cancer, and talk a little bit about mind-body medicine, another emerging field in terms of how it helps patients with chronic illnesses. And then I might talk a little bit about lifestyle medicine. I'll see how it goes. And then I'll ask a question if there is a way to integrate some of these evidence-based therapeutic interventions in cancer management. And then I'll share with you my final thoughts. So I'm a graduate of Delhi and went to the United Kingdom, and then I moved to the US in 1984. And so I've done some teaching, I've done some research, but largely I've seen a lot of patients, and I also do public health. I cannot tell you every time I bring the turn on a CAM or alternate medicine that a lot of my physician colleagues, how they make fun of it. And they should, because historically, alternate medicine has done things that have not been helpful to patients. But I think, and that's changing, I'll get to that. And these are a couple of cartoons to share with you in terms of the feelings of many doctors, the way they think about CAM. So I am not here to say that we should be using CAM in place of proven treatments. Not at all. I'm a medical doctor. I take a Hippocratic oath, like most of you, and therefore, of course, we all mean well. And nor am I discussing CAM versus conventional modern care. What I'm here is to present to you perhaps some evidence which might suggest that there may be a role for CAM in cancer management. And again, I'm using cancer as a clinical issue, but a lot of these things may apply to other clinical problems as well. So, and you're a wonderful scientist. I'm hoping that I might come to a point where I might match some of your descriptions. I'm a simple healthcare provider. I see patients, and I also do public health. And we've seen in oncology, oncologists have done tremendously well. As has been described, new tools, new diagnostic ways to handle patients, treatments, and so on and so forth. All of which has resulted in a decline in mortality rates from cancer. But even more importantly, their survival. Patients are living longer. The question is, are they leading a quality of life that I think is reasonable? And I'll get to that in a second. But not to forget that with all this, there are many challenges. And I've done chronic disease management. I've said to you that I think we, as medical doctors, oftentimes we treat the disease, not the patient. And I find a difference in treating an illness in a person rather than treating a person with an illness. There's a distinction between those two. And I think there's also less emphasis on lifestyle medicine, nutrition, physical activity, and so on and so forth. And of course, not to forget that there are challenges surrounding the increasing cost of healthcare, including in cancer. So I'll present to you a couple of clinical examples. and later foundation. So here's a 55-year-old woman, and this is from New York, with breast cancer. It's a woman, not a woman, who wants to discontinue chemotherapy due to the side effects of fatigue and vomiting and nausea. And we know that's a common symptom with chemo. And this lady who was referred to our integrative medicine clinic did extremely well with a combination of cognitive behavior therapy, acupuncture, and mindful meditation. And there have been other stories of patients with cancer pain who did quite well with acupuncture, and I'll talk about acupuncture in a second. So while there are benefits with CAM, there are also risks and limitations. And here is one example of such risk. A 50-year-old woman, smoker, evaluated by many specialists and diagnosed with chronic fatigue syndrome and irritable bowel, commonly occurring problem in day-to-day practice. And the reason for this was because she was taking large doses of vitamin A, E, and vitamin C, antioxidants, with the hope that she would reduce the incidence of cancer because she had a strong family history of cancer. Sure enough, when I saw her and I told her, if you can share with me what she takes, she had a bag, a polythene bag with so many bottles in them. I was barely into the fourth of the bottle and saw that she was consuming excessive quantities of these. Now, if you, and you will know this from your clinical knowledge, that patients on excessive dose of vitamin A and E can behave literally like patients who suffer from chronic fatigue syndrome. Also, patients taking vitamin C in quantities exceeding 1 gram, 2 grams, will have bloating, they'll have abdominal cramps, they'll have diarrhea, constipation, and in this case, she was diagnosed as suffering from irritable bowel syndrome. My clinical recommendation to her was, you've got to stop taking it. She was shocked, but sure enough, 4 weeks later, she recovered completely without any ongoing problems. So, in New York, because doctors in the mid-90s were not allowed to do CAM, there was so much pressure. New York State actually amended its education law to allow physicians to integrate CAM in a way that they found useful for its patients. And that was a hallmark, and certain other states in the US now allow use of CAM or practice of CAM by physicians. And the point that New York made was, so long as there is informed consent in place for the patients, that it would be okay, but it must be evidence-based. And I'll get to that in a second. So let's look at these terms. Of course, we think of healthcare as conventional and unconventional. And unconventional is the so-called CAM. The word alternative, which seems to suggest we're providing something in place of, I think, a useless term. It does not correctly characterize the view of physicians who might provide CAM. It's not a good word, because it would seem to suggest that, though, if I'm a physician providing care, then I'm providing alternative medicine in place of another proven treatment. I think a better word is complementary, which suggests that it's enhancing, that patients are receiving approaches that might be in addition to other modern conventional approaches. I think it's a healthy term. And here are some examples of those. As I said, I'll talk about them in a second. I think the way the world is moving is the integrative approach, where you get best of the both worlds, so long as they're evidence-based. So evidence-based approaches, whether they're conventional or unconventional, basically constitute integrated medicine approaches. And I think that's the way we're moving. And if you look at the use of, and again, just a snapshot of the use of these modalities by patients around the world. In America, for example, about 35 to 40% of people use CAM. And when you look at the use of CAM in cancer patients, studies have shown that depending upon where you live and or work, or where patients live, anywhere between 35 to 80% of cancer patients are using CAM. When you look at that statistic, and if you're an oncologist or a specialist, you cannot ignore this finding. It's prudent that we as medical doctors inquire about these modalities, and as if I have time, I'll explain that there could also be interaction between some of the remedies and also conventionally used medications. But here's the problem, that conventionally doctors have never been trained in this field, so our knowledge is poor. So where on the one hand you have patients using these modalities, and on the other hand, that practitioners have poor knowledge or inadequate knowledge, right there is a disconnect, a mismatch. And that mismatch, in fact, in the US, European countries, there's also a lot of interest in the Indian subcontinent. We are beginning to see emergence of, as I said, integrated medicine centers around the world. And here are some examples of what we are seeing in the US. So let me just present to you very briefly some of the evidence that we are aware of in this growing field. The first one is mind-body medicine, and of course historically, and this is true even in our ancient culture here in India, that there's a connection between mind and the body where functional one affects the other. So for example, exercise, if you exercise, your anxiety scores are much lower. And if you meditate, your blood pressure begins to go down. And this, both the relationships are bidirectional, it's mutual, and we as practitioners have used this in helping our patients in techniques such as meditation and so on and so forth. But this is the fascinating part, that we think that there might be intertwining of this connection with this, what is emerging as a psychoneuroimmunological basis to many of these approaches, in which the psychology of a person, which in turn is influenced by expectations, beliefs, and so on and so forth, is talking with the neuroendocrine system and immunology. All of this in an equation such that if you have a lower level of anxiety and you have a positive attitude in life, and if you're connected in your social fabric extremely well, you will end up having a positive outcome in chronic disease. And I've seen this. I'm a practitioner. I've seen this with wonderful results. That, as opposed to a situation where a patient is stressed out, feels hopeless, will almost invariably end up having a negative outcome. And this has been shown by being honest in California with regard to atherosclerosis, but also with cancer. So we know that, of course, and we spoke about this yesterday, that the psychosocial stress in cancer is serious. It's a major problem. It impacts on patient compliance. It affects quality of life and outcomes. And again, it does things to you that are hard to imagine. For example, we know it can create depression, anxiety. It can cause pain. It can even exacerbate pains of treatments. Chemotherapy is a case in point. But more often than not, basically when patients give up, they're beginning to basically give up a life, don't eat food, don't enjoy life, start to smoke, and so on and so forth, adding more insult to the existing condition of cancer. So again, without going into the details, I can tell you for each of these there's a slight citation, including citation from the NIH, National Complementary Center in the US, that we have seen, and these are just examples of some of the mind-body techniques which are extremely helpful to patients with cancer, namely CBT, relaxation therapies. Yoga has been found to be extremely helpful, hypnosis, Tai Chi, but more importantly, doctor-patient relationship, which rests on this mind-body connection or psychoneuroimmunology, is becoming extremely important. Patient-centered care. As I said to you, we are not treating patients, we are treating the disease in a patient rather than treating patient with an illness. And here's a quote from Helmet, given by one of the scientists, who said there's increasing evidence that outcomes in situations where a provider shows empathy trump those where they do not. The days of old-fashioned paternalistic care are coming to an end. All hail the new day. So much so that all the newspapers, at least in the US and Europe, are beginning to catch on this. This is New York Times from 2015, telling the doctor to shut up and listen to me. This is a patient telling the doctor. And that's from USA Today, where doctors are literally pushing patients out of their offices, breaking therapeutic bond that we're supposed to build as caring physicians with our patients. So what about acupuncture? Well, I'm going to ask a scientific question. I won't get into the Chinese way of thinking about qi. I'm going to ask the question, does it work? And if it does work, what's the biological mechanism for acupuncture? So again, umpteen references, including from NIH, BMJ, Annals of Internal Medicine. It has been shown based on randomized controlled trials I'm also an acupuncturist, by the way. I have treated patients with acupuncture. It has been shown that acupuncture can help patients with musculoskeletal pain, nausea associated with chemotherapy, and also during anesthesia, tension headache, osteoarthritis, myofascial pain, and also tremendous results insofar as depression, anxiety, and concern. There was this feeling my friends would tell me, Ravi, but it's only placebo, and that's nonsense, because this is a write-up from Archives of Internal Medicine in 2012 that makes the point that acupuncture does more than placebo. So how does it work? Well, when you stick a needle in skin and at designated acupuncture points, you're basically causing a cascade of reactions at the level of spinal cord, midbrain, and hypopituitary. Now, I wish I had more time, but basically what I'm saying here is that acupuncture is, and it's producing cortisol, monoamines, endorphins, and so on and so forth. It is essentially, as we're beginning to understand, a neurotransmitter-mediated response. And here's a listing of some of those neurotransmitters that are released. And if you look at them, you might be able to rationalize the use of acupuncture in the conditions that I was referring to. So the question is, in cancer, where can acupuncture help? It can help a great deal. Patients who experience nausea and vomiting with chemo, cancer pain, or even comorbid musculoskeletal pain can be helped. Hot flashes from hormone treatments for breast and prostate cancer, a lot of work done by NIH in the US, and more recently we're beginning to understand the role of acupuncture in fatigue, neuropathy, and xerostomia, which you might see with radiation in the head and neck. So a couple of words about the supplements. Extensive use of supplements worldwide, including antioxidants. And here's a summary statement from NCI, NIH, the US. And again, I don't have time to talk about it, so I'm going to rush it, but I'll take another 2 or 3 minutes. I want to finish my story. Famous trials have basically shown that there is literally no evidence to suggest that antioxidants can help in primary prevention or chemo prevention, as I was reminded this morning, insofar as cancer is concerned. What about treatment? No evidence again. No persuasive or convincing evidence. This is a quote from NIH in the US basically says that, folks, until we know more about this, please be very careful in prescribing antioxidants to your patients, especially in large quantities. It can present serious problems. So a word about lifestyle medicine. This is another area of my interest. You know how we say that patients die? When we write death certificates, we say patient died.
Excuse me, sir. Just 2 minutes might be allowed. So please summarize.
Yeah, so I said I'll take 2 more minutes because we'll allow 2 more minutes. Okay. All right, let's skip this. So clearly there are opportunities and I'm sorry, there are also dangers and risks, and I don't have a slide here in front of me. And here are examples of those dangers. Providing CAM in place of proven treatments will not be the right thing. And also, without a workup, it would be inappropriate. And the reason for that is because providing unproven treatments in place of proven would not be a good thing for us to do. I think there's a place for CAM, for doctors in mainstream, so long as there's informed consent in place and there's been a diagnostic workup and we understand. And I think a complementary role where we encourage the use of some of the proven treatments would be better, while being brave enough to discourage the use of those that are not helpful. So as I explained, these are some of the situations where CAM can be helpful to our patients. I'll leave you with a couple of thoughts that I think CAM is here to stay. Let's not fool ourselves. It's here to stay. The challenge for us is to tease out the difference between modalities that are helpful from the ones that are not helpful. And I feel that this division between unconventional and conventional is an arbitrary one. We should have one healthcare system, a system that rests on evidence and which has demonstrated its value to it in terms of efficacy, effective treatment, and safety, while taking into account the values of the patients. So with that, I conclude my remarks. I'll be happy to take any question that you might have.
Thank you, Dr. Mamtani, for your nice talk. I think the patients will be more benefited from this non-conventional method of treatment of physical therapy. Any question from the audience? Just one question, please. No question. Okay, thank you, sir.
I have one question. Hello. I had one question to you. That was a great talk. You know, we talk about supplements that are not being helpful and no evidence and all that. May I ask you one question?
Please.
Most of the time when we take supplements, as you know, it's not just one antioxidant, there's a lot of other stuff. So unless we really look at, say, vitamin A or vitamin C or whatever real pure compounds as antioxidant, I don't think we can really tell. Am I right?
Yeah. So I think you made a good point. Patients often ask me, you're right, so when you take a pill, there's everything in it.
Right.
And patients always will say, am I okay to take multivitamins a day? And my recommendation is, if you're taking supplements for the reasons of supplementing your diet in moderate quantities, there's nothing wrong. It's when you exceed the doses that are recommended, that's where you end up having trouble. So excessive doses is where the emphasis is, and that's the point I was making, is not a good thing to do. But one multivitamin tablet a day, if you're erratic in your eating behavior or in your habits, that's fine.
Thank you.
Thank you so much, sir, for the beautiful speech. Can I have a round of applause for this gentleman? Yeah? So we are moving to the next speaker who is going to speak. None other than Dr. Linga, who is going to speak upon herbal medicine offers a great potential in sport of metabolic cancer therapy. Can I call Dr. Linga? He's there? So you can come to the stage.